لما اجي اعمل بانش انا دلوقتي مثلا زي ما اتفقنا انا عايز اعمل ريستوريشن للتوث دي، فانا عندي اكتر من حل ان انا اعمل single tooth isolation او ان انا اعمل quadrant isolation. Okay, now we have two choices, either to do single tooth isolation for this tooth only, okay, or I will do quadrant isolation. I prefer always quadrant isolation if you have time. If you don't have time for like if you are doing access for a patient, for an endo patient, if you are doing access, if you will remove the caries, you can use a single tooth isolation. I will show you how it will work. Okay, first we will choose the hole size. I will use this one. Okay, this is the sheet. For punching I will do like this, and don't elevate or don't release your hand until you hear this sound. Okay, and when you press, just if you can see it's not completely cut, so you should cut it, free the sheet all over the stylus. You should free your hole, okay, to have a uniform hole. To have a uniform hole like this, you should like this again. I will do a hole in another place like this until you hear this sound, chick. It means cutting. When you hear this, you should free your sheet. If you can see this, now, the hole is not completely cut. Okay, if you remove the stylus now or the punch now, you will not get a uniform hole. So you need to free this one like this. You should move your sheet like this until it's got all free. Remove it and you will have a uniform one. Okay, we will take another one and we'll let you see the difference. Like this, if I am punching and looking to anyone and punch like this, you see the difference. Don't release your punch until you free your hole. You can see the hole is not uniformly cut. If you make this hole, this strong hole, and cut this part of the sheet, your sheet will be cut. Okay, no, anyone needs it in Arabic or it's okay? Because we have some colleagues do not need English. كنت بقول انه لو in Arabic now لو انا هعمل single tooth isolation فانا عندي توث واحده مثلا ولتكن اللور 6 ده هعمل بانش عليها هي بس. طيب هعمل بانش ازاي؟ لما اجي اعمل بانش، ودي نقطه مهمه جدا وانت بتعمل بانش، لما اجي اعمل بانش انا دخلت جوه عادي خالص اهو على النقطه مثلا اللي انا محددها وهبدا اعمل كات. لما اعمل كات هضغط هسمع صوت تشيك. التشيك ده معناه ان انا بدات اقطع. لو جيت رفعت ايدي فجاه، بص انا لسه ما شلتش ايدي، لو شلت ايدي شايف ان الهول نفسها ما اتقطعتش، الفتحه دي ما اتقطعتش كلها. طيب الحل لازم اعمل فرينج، يعني انا ابدا اشد الشيت حوالين البانش عشان اتاكد ان هي بقت يونيفورم. بص كده للهول اللي احنا قطعناها بقت يونيفورم. ليه يونيفورم؟ لو انا قطعتها وريحت دماغي ايه اللي ممكن يحصل؟ اللي ممكن يحصل انه ممكن تبقى سورس اوف ليكج. طيب لو انا ما خدتش بالي وعملت يلا انا بصيت اللي بكلم واحد صاحبي وبقى يلا بص كده على الفرق، بص فرق دي ودي. لو جيت شديت الجزء اللي ما اتقطعش ده هيعمل لك شرخ جوه. كويس، الشرخ ده ممكن الرابر دام شيت نفسها تتقطع. This is the difference. So we have many tricks for the or many techniques for placement. First of all, you can place your clamp like we said before. I can use please one moment. When you hold the punch, don't hold it from upward. You hold it from downward like this and press like this. Okay, don't hold it from here. Okay, because when you have your clamp here and introduce it inside the patient mouth, your finger can press on patient lips, teeth. You can hurt yourself or you can make pain for the patient. So you need to see it clearly. So place it like this, like you an extraction. You hold your forceps like this. طيب in Arabic again. اعذروني معلش انا تعبت. لما اجي امسك الفورسبس ما امسكوش من فوق كده كويس، علشان ممكن وانا مركب الكلام، حاطط الكلام هنا ورايح للبيشنت ماوس عشان اركبه، ممكن الاقي صباعي ده بدا يضغط، خد مثلا الشفه اللي تحت بتاع البيشنت مثلا حطها على الاسنان بتاعته وضغط، فساعتها بيبقى سيفير بين. الافضل ان انا اعمله من تحت، اخليه هنا على البلم كويس، همسكه كده عادي خالص اهو كده كويس علشان ابقى شايف كويس، وفي نفس الوقت انا هضغط كده كأن انا ماسك فورسبس بالظبط للاكستراكشن. In English again, there is many techniques. First technique is to place the clamp first. After you make displacement for the clamp, the clamp is retentive as we said. Now we have a hole here for the clamp, so we stretch it like this, stretch it. It will not be cut, hopefully. And you can pass your clamp like this. Pass the bow first, okay? Not the arms. The bow first, okay? Like this. You have the isolation. But look here, it's not completely isolated. So you should bring your sheet to be like this. Okay, this is finished? No, it's not finished. With a floss, you should pass this sheet between the two teeth like this. You press and like this, and you withdraw it like this. Okay, from the anterior part, and from the posterior part. You should pass it from the posterior like this. Okay, because it's moving, I need someone, but I don't have anyone here with me. So you should pass it from the posterior end of the clamp, and you should pass it. You know the idea now. It's moving now. Sorry. Okay, you got your isolation right now. If you need to do a single tooth isolation for an axis or for your cavity. For me, I don't usually use this one because I need the other teeth to make the anatomy I need. So I need quadrant isolation. So the first one, you can use the clamp first and then the sheet. There is another technique for the single tooth, yes. You have your sheet, okay? Make your clamp ready with the forceps, okay, like this. The first technique was place the clamp within the sheet. Now we will put the sheet then the clamp, okay, the sheet like this. You can hold it like this with your two fingers, okay, and then your clamp like this. After this, you should stretch your sheet for all projections like this. Stretch your sheet. You don't need the sheet to be folded like this. It's stretch it, okay? After you place your clamp, again with floss, pass it anterior to the tooth to make sure we don't need surprises. Okay, so you should place your dental floss between the two teeth to make this sheet pass between, and also from the posterior to the molar you are working on. In Arabic again, في طريقتين. الطريقة الأولى إن إحنا ممكن نحط الكلامب الأول وبعدين الشيت زي ما شفنا، أو ممكن نحط الشيت وبعدين الكلامب. في الحالتين لازم بعد ما هركب الكلامب والشيت إن أنا أعدي فلوس anterior للتوث وبوستيريور للتوث عشان أتأكد إن الشيت نزل في الكونتاكت. ده هيفيدني في ايه؟ انه انا ممكن في لحظه الاقي حصل ليكج للسلايفا. Okay. Again in English, we will do now quadrant isolation. We have many tricks, many techniques for the quadrant isolation. دلوقتي هنتكلم عن ال quadrant isolation، مش هنتكلم على ال single tooth. Okay. زي ما اتفقنا as we said earlier, we place the whole projections. If we need to make marks on the teeth, we should work on like this. I made it for the whole projections. Stretch your sheet and make your one for the molar and the central between buccal and lingual, one for the premolars, two premolars, and for the canine, all on the buccal cusp tips. Okay, like this. You should stretch the sheet. There is no Dr. Faraj. مفيش طريقة ممكن أقول أفضل، يعني كل طريقة لها كل حالة لها طريقة معينة لازم تعملها، بس الأفضل طبعا احنا بنتكلم quadrant isolation مش سنجل توث. سنجل توث ده لو انا ما عنديش وقت اصلا للبيشنت ده، فسنجل توث ممكن سريعا يعني، بس هنقول دلوقتي الافضل في على حسب اختيارنا. طيب now we have 4 marks. We should do punch like we said, one for the molar. This is the molar, the anchor tooth which will have the clamp like this. You hear the this voice. Okay, as we said, free your sheet like this, free it, okay, until you get a uniform hole. Then move your table to get the third one for the premolar like this, and punch, free your hole, punch, free your hole. Now we will have one for the canine like this, the one before the last for the canine. You should hear this voice and free your sheet. We got our 4 holes like this. There is another trick to make this sheet pass easily through the contact. You can use lubricant on the inner surface. Lubricant, maybe soap or Vaseline. Okay, small increment, especially if you are doing restoration. I don't recommend it in cementation because Vaseline may get through your holes and make it difficult. نتكلم عربي سريعا. We will talk in our Arabic again. احنا دلوقتي علمنا ال4 علامات اللي احنا عايزينها على الاسنان اللي احنا عايزينها. عملنا بانش، وانا في البانش ان انا ماسك الشيت وبحاول اعمل له فرينج، ما بشيلش ايدي من على البانش الا لما هيحصل فرينج، كومبليت فرينج. اوكي، فانا عديت خلاص. ممكن احط لوبريكانت هنا من جوه في الانر سايز، سواء صابون سائل او فازلين او حاجه تعمل لوبريكانت، بس نقطه صغيره مش حاجه كبيره. كويس. طيب there are many techniques for this. We can use this as the single one. We can stretch it like this, stretch it like this, and place your first the tooth which you will clamp, then complete it. Okay, this is the first technique: sheet and frame, then the clamp. Okay, if I have a patient with large tongue or high gagging reflex, what should I do? There are 2 main techniques we can use, one with the wingless clamp and one with the winged clamp. Okay, first of all, you should remove the frame. We have the sheet now. okay, and the 4 holes. If we will work with a wingless clamp like 26, this technique is called the bow technique. Bow means this part of the clamp. Okay, okay. Our clamp will be like this in the tooth. Okay, it's clear now, right? Okay, so we will stretch the sheet like this. Stretch your sheet. Pass your arms under the sheet. Now you have the only the bow above the sheet, right? From downward you got the 2 arms. This is the bow technique. How will I place it? Like this. I have the clamp here, I have only the bow. I will elevate the sheet like this on my hand like this. Okay, I have the clamp here from downward. I will place my forceps here, place it on the tooth like this and leave it. Okay, then easily, smoothly you can pass your sheet under the clamp like this. Okay, now you have your clamp, then continue to the other teeth like this. Sometimes you need an assistant. I never use an assistant with me, but the cost is moving, so sorry for this. You will pass your other teeth. We will do it again. Okay, this one is called the bow technique. For the wingless one, the wingless clamp, there is no wings. If we have a winged clamp, earlier in the first live we talk about winged and wingless clamp. Okay, shall we speak in Arabic? Okay, we will speak in Arabic in brief. لحبايبنا الأخوة اللي بيتكلموا عربي زي حالتنا. في طريقة لو اللي عندي المريض لسانه كبير شوية ومش عارف أعمل الطريقة اللي أنا أحط التو، خصوصا الناس اللي بيبقى لسانها كبير ده بتحس إنه عنده جاج ريفلكس عايز يرجع كل شوية، فمش هينفع إن أنا أحط الشيت والفريم وبعد كده أحط صباعي هنا وبعدين أحط الكلامب، مش تنفع. لازم أحط الشيت والكلامب الأول. إزاي؟ في طريقتين دول معتمدين على الكلامب نفسه، ديزاين أوف ذا كلامب. في عندي الوينجلس كلامب اللي احنا اتفقنا عليه، في طريقه اسمها البو تكنيك. البو اللي هو الجزء من الكلامب اللي هو الجزء اللي فوق ده اسمه البو. انا هعمل ايه المفروض؟ انا معايا الشيت، بس انا اركب دلوقتي الشيت والكلامب. هعمل ستريتشنج للهول دي وابدا اعدي الكلامب منها، اخلي التو ارمز تحت والبو بس هو اللي ظهر فوق. يعني لو بصيت على الشيت من فوق البو بس اللي ظهر، مفيش حاجه تانية ظهر، مش الكلامب اللي ظهر. لو رفعت وبصيت تحت هتلاقي التو ارمز. طيب ازاي اركبه؟ هبدا الف كل الشيت كده، اخده في ايدي كده بالراحه عادي خالص وابين الكلامب بالمنظر ده مع الفورسبس. هفتحه وابدا انزله على التوس اللي انا هشتغل عليها كويس، بدون ما هروح ناحيه لسان البيشنت ولا اي حاجه. بعد كده هبدا بالراحه خالص ارجع الشيت زي ما كان وابدا اعدي. يعني يفضل ان انا ما اعديش الشيت كله مره واحده، لا اعديه من جنب الاول، مثلا هنا من البقه الاول، وبعدين اعدي من اللينجوال، تمام، وبعدين اكمل الايزوليشن بتاعي عادي خالص. اتفقنا؟ ده البو تكنيك. This is the bow technique. We will be again back to English. The bow technique for the wingless clamp. Okay, if I have a winged clamp and I need to work with a winged clamp. Here we have a winged clamp. This is 2 central wings and those are the other 2 wings. Okay, so how will I place it? This technique is with sheet and the clamp. Okay, this is the clamp. For winged, now I have a wing, so I can apply the sheet to the wing. So like this, I need you to see. For the wing like this, and stretch your sheet to the other wing. Now you can see it. The wing is covered with the sheet, the other wing is covered with the sheet. Okay, you can see it now clearly. Okay, How I will apply it? Like the same I did, like this. I will open the clamp. I need to see the tooth. Okay, first before I open the clamp, open the clamp and apply your clamp to the tooth like this slowly. Take care of the gingiva like this. Okay, after this I still have the sheet over the clamp with a composite spatula like this. Don't use a probe or a sharp instrument. Please don't do this. Just a blunt instrument and the sheet should slip over the wing like this and like this. Okay, and then you can stretch your sheet to the other teeth. Okay, I need you to see this trick. Here, if you can see that this area is not fully covered with the sheet, right? This will be a source of leakage. There is something called clamp rocking. Rocking means shaking. How will I cover this area of leakage? This area of leakage. I need to slip the sheet here under the clamp. Okay, so I will open the clamp from here only to make the sheet slip under the clamp. Like I will place my forceps again, press from here, from the lingual part, press against the tooth and open the clamp from only one end like this. Okay, you are pressing and open it. The sheet, you can lift it up, the sheet will escape to the tooth. Okay, you will have your sheet between the tooth and the clamp. This is clamp broken. Clamp broken means you need to slip the sheet under the clamp. لحبايبنا العرب سريعا. الطريقة الأولى اللي احنا اتكلمنا فيها اسمها البو تكنيك. ده بنتكلم عليه مع الكلامبلس الوينجلس كلامب. عندنا الوينجد كلامب، عايز اركب وينجد كلامب، انا مش عايز انا اركب وينجلس كلامب. الحل انا عندي هنا تو وينجز دول هيشيلوا شويه، هيرفعوا الشيت. فانا اول حاجه هدخل وينج هنا، دخلت وينج بس عادي خالص اهو، عملت الشيت على وينج اهو، وبعدين هبدا اعمل ستريتشنج للشيت على الوينج التاني. فالكلامب بقى عندي بالمنظر ده، الشيت فوق الوينج، فوق المين وينج. تمام. بعدين هبدا افتح الكلامب واعمل ابلكيشن على التوس اللي انا هشتغل عليها like this. طبعا يفضل الحوارات دي يفضل فيها اسيستنت يعني، بس ما علينا. بعدين هنركبه عادي خالص على التوس اللي احنا عايزينها، زي هنفتح الكلامب عادي وننزل. طيب هنسيبه كده؟ لا، انا عندي شيت المفروض اصلا على الوينج، فالحل ان انا بلانت انسترومنت بلاش بروب، لان البروب ممكن يقطع الشيت. بلانت انسترومنت وابدا انزل الشيت من على الوينج كويس. بعد ما اخلص، المفروض حركه الروكينج هعملها بعد ما اخلص كل ايزوليشن اللي انا هعمل، يعني اعمل كل ايزوليشن. طيب لو جينا بصينا هنا شويه هنلاقي انه في سبيس هنا بين الكلامب والتوس. السبيس ده ممكن يعمل ليكج في لحظه، يعني ممكن فجاه تلاقي ليكج. طيب الحل ان انا اعمل حاجه اسمها كلامب روكينج. ازيك يا حليم؟ شكرا يا حليم. اعمل كلامب روكينج. كلامب روكينج يعني ان انا اعدي الشيت بين الكلامب والتوس. هعمل كلامب روكينج ازاي؟ انا عندي مثلا الليكج في البكل، يبقى انا هفتح الكلامب بتاعي بكل بس، لان انا عايز الشيت يحصل له سليبج تحت الكلامب من البكل كويس. نفس الفكره ان انا هفتح بس، هضغط من اللينجوال وافتح بكل. والشيت المفروض ان الشيت يعني احنا اتفقنا هعمل الروكينج بعد ما اخلص الفول ايزوليشن بتاعي واركب الفريم، فالشيت هيبقى مشدود. تعال نبص هنا بعد عملت روكينج هلاقي الشيت عدى. هنا الشيت عدى معناها انه مش هيحصل ليكج. طيب لو انا عايز اعمل روكينج في اللينجوال نفس الفكره، هضغط بالكلام بناحيه البكل وافتح لينجوال، بس هتلاقي اللينجوال اللي بيفتح، البكل ما بيفتحش، البكل ثابت. وبعدين اخلي الشيت يعدي بس تحت واقفل. اتفقنا؟ طيب ده بالنسبه للتكنيكس ان انا اشتغل سواء انتيريور او بوستيريور مع وينجد او وينجلس كلاب. خلينا بقى نروح نعمل now we will make a quadrant isolation. Okay, and we will have only the floss ligature and we are done for today. As we said, you should fix your sheet to the all projections when you are making the holes like this and stretch. You can use the template. I mainly use the template, but if I have a spacing patient, crowding patient, I use the this technique. Okay, like this. And we will punch. We talk about how we will punch, right? Like this. We will free the sheet like to make a uniform one. Don't rush. Okay, take your time because any mistake you will pay for it. Okay, we have now the 4 holes. Now I will work like the sheet and frame together, and I will place the clamp afterwards. So I will stretch it like this, more stretching. Like this, more stretching like this. I will take a clamp, let's say it's the 26 like this, and place it smoothly, don't press. We tested the clamp first, right? Like this, okay? Then we need to pass the septa first. The septa is the part of the rubber dam sheet between the 2 holes. It's called the septa. Okay, you need to place the septa first between the teeth. If you have tight contact, it will be very difficult. You will have to have an assistant. And sorry, I don't have an assistant now. Okay, you press it like this to pass it. If you press too much, you will get this. If you don't test your contact, you will get this, because we have a tight contact here. We said we have tight contact here. Okay, so if I have a tight contact, I should place a wedge first. Okay, and I don't have wedge now, sorry. Okay, I can have the other sheet. If anyone have a question, you can press the question mark and place your question, and I will reply the question after I finish. So again, hope it will not cut now. Okay, I will place for this lower 6 first. We shall place the clamp first. The situation is more easy in the patient mouth because the patient mouth is not moving like this. Okay, like this. If you have a tight contact like this and you cannot pass it, you can ask your assistant to pass a dental floss here, okay? But I don't have an assistant, so like this, floss, and you press like this, press downward. Okay, hopefully this happens. You can see now after I press the floss downward, you now can see a piece of the sheet. If you remove the floss completely, this sheet will tear. So what will I do? I will bend it again like this without removing. I will bend it like this and we'll go for second insertion. Okay, now if you have more, you can bend it like this again. Don't remove the floss until you completely remove it. You make sure that the sheet is downward. There is no sheet now here. Okay, make it for the other two teeth like this. Sorry, the cast is moving. Sorry, I'm really sorry for this. Okay, you still need a patient. Sorry, you need an assistant. You press it like this. You can see if you remove the floss like here, you will get a tear here. So I will again bend it like this, another one, and go more, third time. Until you got you still need an assistant for sure. This nearly do not happen inside the patient mouth. I never do it, maybe once or twice, not always. The floss. The question here, to use a waxed dental floss or non-waxed one. I prefer to use the waxed one because it will not tear. Okay, still have this canine. I told you need an assistant. I usually do this, but this costs. It's a cost. Now I think I can fix it now. Okay, it's better now. Okay, so there is one more trick for the anterior part of your isolation here, the anterior part. You have two choices. The anterior part here in the canine. If I'm making a quadrant isolation, I still have to make it stable here. You got أظن كده you got a tip here. The tip here is to place a clamp. You can place a clamp here, but your field of isolation will be narrow, so you don't get the advantage of the rubber dam. So there is another trick to place a widget, not a wedge, a widget, a plastic one here, a rubber one, or you can with a scissor. You don't need this tip. You can cut this tip like this. I have a small piece of rubber here. Okay, I'm not lucky with this. Cut a small rubber from the sheet and stretch it like this and place it anteriorly in the contact like this. If you have a tight contact, it will be stable like this. You can see it now, right? Like this. Your anterior part will be secured. If I'm working here, I'm not worried about this to be a leakage here. There was no leakage here. Okay, this is the trick. You can place. If I need to remove it, the way I insert it, I stretch it and elevate it. Okay, like this, it's out. If I need to insert it again in Arabic. بعد ما خلصت الايزوليشن بتاعي دايما بيبقى عندي مشكله في الجزء الانتيريور بارت اوف ايزوليشن، ان ممكن يحصل ليكج او ممكن تلاقي الرابر دام شيت ده كله طلع. فانا عايز اعمل سكيورنج، ان انا بمعنى انه انا اثبت الجزء اللي في الطرف ده اللي في الاول ده. عندي طريقه انه انا اثبته بكلامب، بس لو حطيت كلامب انا ضيقت المكان اللي انا شغال فيه، الجزء اللي انا شغال فيه انا ضيقته، وده ما خدتش الفايده الاساسيه من الرابر دام، لان الرابر دام المفروض ان انا هيديني ستريس فري، ان انا ابقى ستريس فري وانا شغال كويس، فلازم اثبته. فانا عندي حل تاني، ان انا استخدم حاجه اسمها ويدجت، حاجه بتبقى رابر ممكن مش عايز اشتريها، يبقى انا ممكن اجيب الطرف بتاع الشيت هنا اللي انا مش عايزه واقص منه حته، هيبقى معايا الجزء، اعمل له ستريتشنج ان انا اشده شويه، وبعدين اعمل له انسيرشن في الكونتاكت هنا لو الكونتاكت تايت. لو مفيش كونتاكت مش هينفع، مش هينزل يعني. لو في كونتاكت، لو مفيش كونتاكت، لو الكونتاكت وايد كونتاكت مش هينزل كويس، وثابت في مكانه كده هثبته. طيب removing the rubber dam, removing it, always start with your end. That means I placed this at the end, so I should remove this one first, and then like this. Okay, and then for a safe removal, don't like this, don't remove it like this, no. For the safe removal, stretch it like this, like this. You can see here, this is the septa. This is septa means the part of rubber dam sheet between the two holes. For safe removal, cut the septa, these septa. Okay, like this. Cut this septa for safe removal. You don't need the patient blood or plaque to be on your face. For the safe removal, then remove the clamp. Okay, this for placement. Last thing, we will talk about the floss toy. We got two ties. Okay, mainly I use ties for the anterior portion, or for the if I have a lingual cavity. In Arabic again, لو انا عايز لما اجي اشيل الرابر دام المفروض ابدا باخر حاجه انا عملتها. يعني انا اخر حاجه انا عملتها كان الجزء الرابر دام اللي انا حطيته بين السنان هنا، فده اخر حاجه انا عملتها، او باول حاجه اشيلها. وبعدين ما اشيلش بقى خلاص، ما اشيلش الكلام واقعد اشيل الحاجات دي. طيب ما دلوقتي انا كان عندي رابر دام شيت محطوط بين الاسنان، فلو جيت شلته فجاه هتلاقي حاجه من الاثنين، يا اما يتقطع ويفضل بين الكونتاكت، يا اما يبقى حظك اسوأ انه يطلع ويطلع لك بقى بلاد وصلايفه من اللي كان موجود جوه البيشنت ويجي على وشك. فعشان سيف ريموفر ان اشيلها بكل اريحيه هعمل لها ستريتشنج من هنا من اي مكان، وابدا اقطع الاماكن دي بسيزرز بمقص. اقطع الاماكن اللي في النص اللي هي السبته اللي في النص دي بسيزرز اللي زي كده كويس. الحاجات اللي اتقطعت في النص دي عشان الكونتاكت كانت تايت في الاول، واحنا احنا ما عملناش حساب دي، فلازم تاخد بالك من النقطه دي. بعد عملت كلامب سيلكشن واخترت الكلامب اللي انا هشتغل عليه، اعمل تيستنج للكونتاكت من الاول خالص بفلوس. اتفقنا كده خلاص. طيب للتاي لازم اجيب، يعني اتمنى ان احنا نجيب ما نستخسرش في الفلوس. انا شغال مثلا باورال بي حلو جدا واكسد وجميل، فانا جبت جزء كبير شويه اهو، يعني لو تنيته 2 عشان يبان كبير شويه، فانا هقسمه 2. الكبير ده هقسمه 2 عادي خالص اهو، مفيش مشكله كويس. طيب في تاي في الاول انه انا اعمل تاي واحده، ان انا اعمل عقده واحده بس. in English sorry, for the floss tie we need a large part or a tall part of floss, of a waxed one like this, divided into 2 pieces, okay, like this. And look at it, you have a loop here. Put your 2 fingers like this, okay, and like this, make a triangle. You can see it now. Play this what I did. I need to elevate the camera a little bit to make you see, so please wait. Okay, this is clear now. Okay, I have a floss here, okay, a large one. Don't take a small part like this and divide it into 2, okay. Then place your 2 fingers like this, make it a triangle. This is a triangle floss. Then downward like this, okay, and take this one. You know what I mean, right? Again, I have the dental floss like this, okay. I will get it like this to 2 pieces like this, okay. Put your 2 fingers here, make it a triangle, then downward like this, okay, downward like this, and your 2 fingers together like this. Take this part like this part, and from downward to be like this, okay. This is single tie, okay. The single tie mainly I'm not using it because it may loosen when I'm working, okay. Is there another way to make the single tie? Okay, like a hanging one, okay. If you are thinking of suicide, you will do it, okay, like this, okay. And you like this, okay. Now you have a hole, this one from downward inside the hole like this, and you got your hang, you got your tie, okay, like this. You press it, this is your tie, the tie you need, okay. The most important tie I use, the 2 ties, okay. We will do it and we are finished today. The same one, the same floss, divided into 2. Place, if you are making one, we are making one now, make it triangle downward like this, okay, like this, downward, and take this tip, this part like this, and you got a 1, okay, a one tie. This is a one tie. Okay, don't close it. The same as we did with the one. Sorry. The same we did the like this triangle, and we take another one, okay, and press this. Okay, you got two ties. Look, this is one tie and this is two ties, like this. Press and you got two ties. You move the tie like this and you will have the tie. Shall I do it again? Okay, I will do it again. It's very easy, very easy. You have the floss here, divide it into two, okay? Put your two fingers like this, make a triangle. This is a triangle. Downward here to take the floss, downward, and then take this one. Again, this part, I will take this part. Downward, close, and take this part, okay? Like this. But don't close it. If I am making one, this is one. If I'm making two, okay, I will press, put another triangle like this, okay, downward, and the same I did with the one, like this, and take this part, and now I got two, one here and one here, okay? Move it until you have one at the end. How will we place it? Now we have two ties. This is the two ties. When you place it in a molar or anterior, let's place it. I have prepared the two teeth for anterior composite one, so be ready for an anterior one. So how will I place it? Okay, I open it, place it between contact first. Okay, between contact first, like this. It's down. I think it's down. Yes, it's down. Okay, press it, pass it between the contact. Okay, after you pass it, don't take it like this. Okay, don't take it like this straight. No, adjust it to the tooth first, like this. Press it like this, and from downward, you can move it. The contact is great, very great contact, really. Really, we will make another one. The contact is great. We will make another one. Okay. As we said, زي ما now in Arabic هنحط عملنا مثلث عادي خالص اهو. نزل ايدي لتحت وهضم صباعي الاتنين مع بعض. هاخد الطرف ده اللي هو المفروض ان هو كان ضلع المثلث اللي ورا ده اهو. هاخد المثلث ده واشده بس شويه وبعدين اعدي صباعي. بعدين هعمل مثلث تاني عادي اللي انا كنت عامله عادي خالص اهو. انزل واخد الجزء اللي انا كنت عايزه. كويس. فكده انا عندي تو تايز مع بعض. اتفقنا؟ طيب تعال نحط البليسمنت. تعال نعمل بليسمنت على سنه جميله بقى، يعني انه كونتاكت جميله هنا. كل الأسنان رخمة فعلا. Okay. This is the end of the gingiva here in the cast, so the floss is not going down. So you can use composite spatula or a blunt instrument to press the floss downward, okay? And then you should close the floss. It's not closing. Like this. Downward. You take it down here. Take the floss down here. Okay, down. From down like this. Don't make it like this. No, from down to take the most retraction part. Okay. Press it downward like this. This is a cast, so normally it goes down in patient mouth, but you know the trick. Okay, so